Hello and welcome to this special broadcast, a discussion that puts the spotlight on what matters the most, your health and well-being. I'm Molly Kampir, and today we are focusing on an issue that affects us all, knee health. After all, knee injuries are a rapidly growing health concern in India. Why is that? What can you do to protect yourself? What are the do's and don'ts? Look no further, we've got you covered. And with us today are two very special guests, Dr. Deepak Chaudhary, Vice Chairman, Arthroscopy and Sports Medicine, BLK-Max Super Speciality Hospital, Delhi, Dr. Prateek Kumar Gupta, Vice Chairperson, Department of Orthopaedics and Head of Sports Medicine Unit at the Sir Ganga Ram Hospital, Delhi. Thanks very much for being here and sharing your time. And we are looking forward to having a very insightful conversation on the many issues revolving around what we just highlighted. But Dr. Gupta, if I can begin by asking you to just tell our viewers more about what really are the immediate telltale signs for a person that something might be wrong with my knees. What are the signs to really watch out for?
So if anybody feels that the knee is not feeling normal, there is commonest thing is to have pain, difficulty in walking, sometimes clicking sounds, swelling, which is persistent. So sometimes we have pain 1 or 2 days because of minor strain that you can ignore. But if the things are persisting, these symptoms are persisting beyond, let's say, 4 or 5 days, and they are affecting your life, then that's the sign to tell you that there is something problem and you need some help and maybe some looking into it by a medical person.
Dr. Chaudhary, if I can come to you to just talk about generally the aspect of knee health and knee injuries in India. What, according to you, are the reasons why knee injuries are increasing in India?
So, most of the injuries to the knee, they occur in sports trauma, majority. So, as sports is becoming more and more competitive, the nature of sports injuries is also becoming quite complex, and it requires a multidisciplinary approach for their management. So, when a patient sustains an injury, he usually, as Dr. Prateek said, experiences pain, swelling, he might have instability. So, these are the warning signs, and the reasons are that more and more people, they are going towards competitive sports, and what was used to be 60 earlier is 80 today. So people even in their 60s and 70s, they are playing competitive games, and as such the nature of injuries is also increasing.
Right, and a lot of us, of course, have a sedentary lifestyle today. What can one do, Dr. Gupta, to really safeguard our knee health and something that can be incorporated into one's day-to-day life when it comes to really marrying those aspects with what is doable in a work situation? Because a lot of people talk about how physical movement might not be possible.
Yeah. So we are looking at the preventive aspect, what we could do to prevent. So the commonest thing is to maintain your body. So conditioning of body is most important. So try avoiding being overweight, which we all are aware. Regular conditioning of the muscles. So muscle strengthening is very important. So if you have a good conditioned body, you are likely to less suffer from injuries and save yourself. The other thing is, if you are doing certain physical activity, as Dr. Deepak said, that the physical activities in India have increased, and now more and more people want to be active, whether it be whatever age, and you are involved. So follow the rules of the game so that you don't have injuries. So the commonest is to have a good warm up. So give yourself 5 minutes before you start doing any physical activity, stretch out, get the circulation good. Secondly, follow the proper gear. So if you are going to walk or you're going to play, have proper shoes, proper gear so that your knee is not put at a disadvantageous position. Third is maintain the body alignment. So do the things in a proper fashion so that you are not prone to injuries. So those are the few things that you should do, and then obviously there are certain things that you can avoid in your day-to-day activity, certain postures, certain things which make your knee prone, like too much of kneeling, sitting cross-legged, squatting, and things where you could sustain twisting injuries. So avoid being in that position. So those are the things that you can do as a common man to prevent or save yourself from injuries.
That's very important because it's a lot to do with something that can be incorporated and followed on an everyday basis and a preventive measure. But let's go back to just talking about the knee injuries that we were just touching upon as well, the different types of knee injuries among different age groups. If you can just help our viewers understand that better, Dr. Chaudhary.
So for this, I think I'll show you this, the model of the knee. And so this is the knee, and then the various structures which are commonly injured are the ligaments. There is a cruciate ligament, anterior cruciate, which binds the two bones together. And then there are cushion-like structures, the meniscus, which serve as a load transmission as well as protect the cartilage. And third, most importantly, the cartilage. So these are the three very important components of the knee joint: the ligaments, the cartilage, and the meniscus. So injury could occur to any one of these three, either together or in isolation, and one has to be very careful to diagnose them correctly and give proper treatment.
That's very helpful actually. Dr. Gupta, I just want to ask you, how exactly does a meniscal tear really compare with the other types of knee injuries? Because that's something that also needs to be understood.
Yeah, so meniscus injury is one of the commonest injuries, because most of the ligament injuries, up to 70-80%, are associated with, along with meniscus injury. Also, meniscus injury happen in isolation. When you have twisting injury, you may or may not have a ligament injury, but you could have a meniscus injury. And the other ways of having meniscus involvement is in arthritis and other condition. So if I were to say that is the commonest injury of the knee, to have a meniscal injury, meniscal tear. So that is the commonest actually, as compared to any ligament or any other injury in the knee.
And what exactly are the symptoms that tell a person that they might have a meniscal tear?
So one of the commonest symptom is pain. So any pain which persists for more than a week or 10 days, then there could be swelling in that particular area, whether the inner meniscus or outer meniscus is involved. And then patient can also at a later stage experience symptoms of locking, like the knee gets locked, it is not straightening up. So these are the three cardinal signs: pain, swelling and locking, which point towards clinically towards a meniscus injury. And of course, there are other diagnostic tests to substantiate your diagnosis.
Right, and since you helped us with that model to just understand the knee functioning better, how exactly does the meniscus play such a huge role in knee functioning? If you can just elaborate on that.
The meniscus?
Yes.
The meniscus is, as we said, is a cushion in between the two hard bones, which are not conforming to each other. The thigh bone is round, while the shin bone is flat. And this is an interface which actually transmits the load from one bone to the other. So it distributes the load equally so that there is no particular wear and tear in one position. It also works like a shock absorber. When we jump, run, the bones do not hit each other. There is a meniscus in between, which is like a sponge, like a shock absorber. Third thing it does is gives stability. So it performs like a concavity where the bones are stuck to each other and they don't move away. Other thing it does is nutrition. So every time the knee moves, it squeezes out little fluid from the meniscus, which works like lubricant as well as a nutrition to the cartilage. So it works in multifactorial ways and is very, very essential and important part of the knee.
Sure, and unfortunately, if it comes to that, if a person is suffering from a meniscal tear, what is the immediate step, and what role does a physical examination, MRI, etc. play, and how is the diagnosis really carried out then?
So any patient, as I said, who has symptoms of who has a history of twisting injury followed by pain, swelling, he becomes a suspicious candidate for a meniscal tear. And then one has to do a thorough clinical examination. There are certain specific tests, including joint line tenderness, and there are some specific tests like McMurray's test, etc., which clinically tell you that this patient is likely to have a meniscus tear. And finally, the diagnosis is confirmed on an MRI, which shows clear-cut signal intensities which point towards a meniscal tear. So these are the various modalities, clinical as well as radiological, which help you in arriving in a diagnosis of meniscal tear.
And are some people more prone to getting such kind of injuries? What kind of sports activities really contribute to meniscal tears?
So any sports where there is sudden abrupt movement or jerk can expose you to meniscal tears and soft tissue injuries.
Like the term knee-jerk reaction, wahin se aaya hai.
Yeah, so like that. So contact sports are the commonest, and if you look at Indian settings, so the sports which we do locally in India like kabaddi, wrestling, cricket are the commonest. But if we look at our practice, and I'm sure Dr. Deepak would also agree with that, we find football is the most common sport that we get the most patients coming with after meniscal injuries. So contact sports, the next is basketball. So jump and land is the commonest time when they actually twist the knee and result in a meniscal tear, and if persists or severe, then it can be a ligament tear as well.
Right, and when it comes to the treatment options, since we are following that trajectory now, when we're at the treatment stage, what are the treatment options then?
So the treatment option for a meniscal tear could be conservative or it could be surgical. Okay. Now conservative means the initial phase where you do a lot of icing, you do crepe bandage or pressure bandage, and then give some anti-inflammatory and maybe some sort of pain relieving physiotherapy. But usually if the symptoms do not subside, maybe say a conservative management of 3 to 6 weeks, then becomes a candidate maybe for an arthroscopic intervention. And then arthroscopy has completely revolutionized the management of meniscus injuries in the way that we can diagnose them correctly, which area they are, and then we have specific instruments or devices with which we can fix the meniscus, suture the meniscus, so that the original function of the meniscus is restored.
Right, so when we talk about meniscus injuries per se, how and can they be mistaken for other knee problems at the early stage, and how exactly does the differentiation happen?
So yes, the meniscus injury can be actually misleading and to soft tissue injuries, sometimes ligament injuries, because sometimes they also present the same way like instability. Ligaments also present with instability. If it's a flap tear of meniscus, it gets caught between the bones and gives you a feeling of instability, which is primarily in ligament, but you can have it in meniscus also. So you may be misled to have thoughts of other injuries. Right. And the differentiation goes with a proper clinical history, where the history should suggest a twisting injury in a particular format, and the patient complains of pain and more like click, catching sensation, locking, as Dr. Deepak said. Those are the symptoms which suggest that there is a possibility of meniscus injury. And then comes the physical exam. So there is a particular line where the meniscus attaches in the knee joint. So as was shown earlier, so if you look at the knee from the front, which is like this, on either side, here and here is the meniscus. So when you are tapping on the knee joint and on the same aspects where the meniscus attached, and if the patient has pain, then you suspect that there is a meniscal tear. Right. And then there are physical tests where basically physically you grind the shin bone against the thigh bone, and the meniscus being in between, that moves with it, and if any part is torn, will not move with the shin bone and will get caught and will cause either pain or clicking, which is again a confirmatory sign that is actually a meniscal that we are dealing with. And obviously in the end, MRI can show you everything else.
Sure, like we discussed. Let's also talk about this differentiation between meniscal repair and meniscectomy. What exactly is the differentiation, and how does one really compare? So
a few years back, the only treatment surgical for a meniscus was meniscectomy, that is, the meniscus was removed. Right. In our post-graduation days, our professors used to remove the meniscus in toto, and we used to feel very thrilled that complete meniscus. But now over the past years, it has been the various studies have shown that meniscus is so very important for the health of the knee and especially for the cartilage. Right. So the treatment has shifted from a meniscectomy to meniscal repair. So wherever possible, whether irrespective of the age, even if the patient is even in 50s and 60s, if the cartilage is healthy, we tend to stitch the meniscus back to its place, so that the important function of lubrication, joint load transmission and cartilage protection can be restored. So in meniscectomy we remove the meniscus, whereas in meniscal repair we repair the meniscus so that the function is restored.
Right, and perhaps one question that many would have is, can a meniscal tear repair without surgery, Dr. Gupta?
Yeah, not all meniscus injuries need surgical intervention. Certain meniscus, but there are particular group where it's a minor tear, which is a small tear less than 5 to 7 millimeters, and also location of the tear is very important.
The location of the meniscal tear.
Yeah, so where in the meniscus is the tear located? Right. So if it is towards the peripheral part of the meniscus where there is a lot of blood supply, so there are good blood supply, so good signs, a good area where it can heal. But if it is towards the central part where the meniscus is thin in structure and its blood supply is poor, then that meniscus is less likely to heal. Yeah. So if we have a small tear, we have it, what we call is red on red, means a lot of blood there, blood supply, which is on the peripheral side. And third is if the stable knee, if they don't have any ligament injuries or other things, which will keep pushing the meniscus every time, then meniscus gets time to heal. So those are the 3 or 4 conditions where if you leave the meniscus as it is and give initially some rest, ice and immobilization followed by rehab, they're likely to heal. But if any of these things are not there, if the tear is big, if it is not on red, means red side, or if there is ligament injury associated which will keep disturbing the meniscus, then non-operative treatment, which is the conservative treatment, is less likely to get the desired result, and there meniscus repair. And with the improvement, as Dr. Deepak said, with the technology now, we have got such good meniscal repair systems and instruments which are very thin and very sleek. They do not cause any damage to the surrounding structure, because very important, like if you're doing the meniscal repair, you don't damage the other structures of the knee, which then later on cause problems. So their instruments are so sleek and so good that you can do the repair without disturbing and causing other parts injury to give us good results.
Right. And speaking of what happens after the surgery, the recovery period, how long does it really take to recover?
So again, recovery is dependent on so many factors, like was it only meniscus injury, or whether there was an associated ligament injuries, whether there was only any other cartilage procedures were performed, and then the most important, how committed is the patient. Right. So once the surgeon has done the job, then it's equally important for successful outcome that the patient also is motivated and he actively participates in the rehab protocol. In general, though the rehab protocol may vary from patient to patient depending on the type of the tear and the injury, but usually for the first 2 or 3 weeks, patient is made to walk, but it doesn't bear full weight, so that that particular area which has been repaired gets sufficient time to heal. Though we can start, if we have done a good repair, we can start knee movement immediately after surgery, but weight bearing may be deferred for 2 to 3 weeks depending on the type of the tear, and then gradually weight bearing is increased, and maybe after 5 to 6 weeks usually every immobilization, the crutches, everything are off, and then the patient is put through specific strengthening program. And in sportsmen, at the end of the rehabilitation, maybe after 4 to 6 months duration, they are given a proper sports specific training so that they can return to their individual sports from which they sustained their injuries.
Which is very important, and for a sports person to be away from what they do obviously is an emotional period as well. So like you're saying, the recovery is smooth and it doesn't take that long, given that the precautions are observed. And physiotherapy is a very important part of that recovery process. So tell us more about the role that plays, and how important is adherence, because like Dr. Chaudhary also said, commitment from the patient to follow these protocols is also important.
So physio is very important, because I say 50% is surgery and 50% is physio in the result which comes at the end of the day to the patient. So it actually starts moving the knee quickly, which is more important, because the moment you restore the function of the knee, movement of the knee, everything, the blood supply, the movements of the muscles, they come out to normal and you start recovering quickly. And it is commitment for at least 3 to 4 months, and recovery period, depending what we take as recovery, normal walking is 4 to 6 weeks, gentle jogging is 3 months, running is about 6 months, and back to sports anytime around 6 months. Yeah. So whole process of this rehab is under physiotherapy, and it's very important to gain the function, strength, and then finally returnability to the sports by specific tests, certain level of fitness achieved, certain level of functions achieved by the knee, which is assessed by the physio and then by the consultant, and only then a person can get back to playing.
Right. There's a lot of concern when it comes to a person undergoing such a procedure, of course. Like you've addressed, a lot of those concerns have been addressed. But one is also, these myths and misconceptions that are there. In your interactions with the patients, what have you observed are the primary ones that need to be busted? Because like you're outlining stage by stage what really happens, it's very important to understand the process.
So these days with so much current knowledge spreading everywhere, most of our patients, maybe 70 to 80%, they are well educated, they know everything about the procedure. But still some people coming from the rural background, especially the wrestlers, they feel that they can go to the masseur and they can get it treated, and then they land up us with still more problems. So, and there are certain myths, especially in this backward areas, where so that knee injury ek baar ho gayi, so that never heals, which is not the case with the present technology. The multi-ligament injuries, where so many ligaments are injured, there is meniscus injury, cartilage injury, even they can be treated and they can also go back to their pre-injury level. So these myths have to be removed, that once a knee injury occurs, it is the end of the career. It is not like that with the present state of knowledge and the technology which is available with us.
Very important, Dr. Gupta, if I can also ask you to outline, this whole concern of can I be fully back in my form after surgery. So like Dr. Chaudhary also is saying, it's a very important part of the understanding with the patient.
Yeah, so one of the myths, as Dr. Chaudhary also said, another myth is that once a ligament injury or once a meniscal injury, it will never heal. Or most of the time people think of surgery is not the best option. All these injuries should be treated non-operatively, which is wrong, because there are certain groups which we highlighted which will respond to non-operative, but the other ones would do very well with surgery. And once you have surgery, then you are confident about the movement and that you have repaired it. So as a result, if you work properly with the physio, you can achieve the stability, and which is tested regularly. And so you will be able to get back to your level of sports only with the combination of a surgery as well as rehab. Obviously, leaving aside the small bits which are small group which will be treated non-operatively, but treatment and rehab combination takes you back to your sports. And there are so many examples of people who have had meniscal repairs or meniscal surgeries and have gone back to doing their full sports without any problem.
I'm sure that sounds very reassuring to all of those who would be listening to this, because it's, coming from the two of you. Obviously, it's, very concerning for someone who is going through this process. So that answers a lot of those concerns. But also speaking generally about knee health and the need for awareness, and how can that be improved, especially in a country like India, the early diagnosis and awareness when it comes to knee health overall, if you both can pitch in.
So as far as knee health is concerned, knee health cannot be seen in isolation. It is the health of the whole body, and not only physically but mental also. So to that extent, I think a balanced life in every way, whether you have to do exercises, that also in moderation, whether you have to eat, that also healthy food, and all these things, they all contribute towards the health, not only of the knee, but also general health. And specifically for the knee, it is basically the strengthening exercises, not only of the knee, but also of your core, upper body, because a person who is playing or who has to participate, he doesn't need to strengthen only those particular muscles, he needs to strengthen his body as a whole. So I think it's a balance in life in all aspects, whether it is exercises or whether it is diet or meditation, and everything they form together help in improving the health, physical as well as mental.
And knee, of course, is the lifeline, and like you're saying, it's about the overall health and well-being. Jaan hai to jaan hai, health is wealth. If you can also, Dr. Gupta, just tell us more about this whole aspect of eating supplements. Do they work? How much should be taken? Is it a gender-based decision as well when it comes to calcium intake? So, if you can just outline for our viewers the do's and don'ts when it comes to the overall knee health, and just whether or not supplements, to what extent, are a good idea.
Molly, this is another big myth which we would like to put on air today, is we all have this that if we take lots of supplements, we'll become Arnold or we'll become Virat Kohli or we'll become, it is not the case. See, what is important is workout, conditioning, and what you are working in gym and activity and your physical training, which is most important. Now, an average Indian sports person does not do more than 4 or 5 hours of workout in a day. And the statistics have shown that if you take a normal diet, which is properly proportionated proteins and all that, minerals, you actually do not need any supplements. If you work out more than 4 or 5 hours, like Michael Phelps used to do 8 hours, so that's when the supplements are really going to help. Otherwise, lots of proteins, lots of amino acids, lots of supplements are being used, which gives us mental satisfaction that we are putting in things. So what is important is to do good workout, and obviously certain time of the life, gender, again, there is no difference in the gender as for the age group is concerned. But if we are on the higher side of the age group, near the menopause or having hormonal issues, so that's when the calcium in females may be required more than males. But as a sports person in a sports life, normal life, you do not need any supplements.
It's rather the overuse can cause more problems and issues rather than, helping.
I was just coming to that because, something as simple as taking antibiotics as well, or even the issue of supplements, there is a lot of awareness that needs to be generated about the misuse, because one cannot just, hop on and take one depending on what they think is required. So if you can just elaborate on that as well.
One of the reason is that a lot of, marketing or sort of mismarketing is happening on social media regarding these supplements. And as he very rightly said, most of the people who do an average workout 2-3 hours, like I do 2-3 hours every day workout, but I don't take any other supplement. I take a good diet, and if you are taking a good balanced diet, that is good enough. Yes, you should hydrate yourself properly, especially in this weather. But taking supplements can be, harmful to your liver, to your kidneys. You don't know the long-term effects what they cause. So one should be quite careful and use them judiciously rather than indiscriminately.
Right, and I have to also ask you, these sit-ups or basic exercises, a lot of online content about, the simple exercises for beginners. Should one be careful to what extent that is this exercise right for me? Should I be doing this or not? So just your comments on, as we wrap this up, what a person should be doing as a part of their routine that is enough for their basic knee health.
Can I answer? So I am myself a avid marathon runner, and I do like gym, and a lot of people come in the gym, and a lot of them come to us with injuries. So very important is that no two individuals are the same. So each one has to work out according to his or her demands or whatever they can endure, and then gradually increase that. What I find in the gym is that they see some person is lifting that much weight, let me also, and then they land up with injuries.
Becomes a competition.
So again in the gym also there have to be phases, like first stage you do a lot of warming up, and then do cardio, and then do strengthening, and last stretching. So everything has to be be done in a scientific manner and not to follow anyone else and then land up with injuries. Dr. Prateek. Yeah.
So it has to be individualized. So one has to understand their own body. What part of life are they? Are we young? Are we middle age? Are we in 60s? So you have to tailor it, and you have to do what your aim is. You have to have your own goal. And as Dr. Chaudhary said, you have to make it slowly. So a lot of time when you go to the gym, they push you both, the intensity wise and the training wise. So you take it and you listen to your body always. If your body is reacting or the body is showing signs of fatigue or problems, then you need to look at what am I doing? Should I be changing it? And always be aware that you should be doing whatever you're doing correctly. And you should have a trainer or somebody guiding you. Until unless you're doing just very basic, that is different. But it has to be tailored to individuals' age and capacity, and sometimes also looking at the medical conditions. Many people have arthritis or some cardiac conditions, so they can do certain kind of workouts and certain type of physical activities they can do. So that is important to know.
Thank you very much for that insightful interaction. I'm sure it answers so many questions that our viewers would have, and it also helps them decide what's good for them, what's not, and raise awareness overall about the options that are out there when it comes to knee injuries and what kind of knee injuries and overall knee health measures that need to be taken. Thank you very much, Dr. Chaudhary and Dr. Gupta, for your time. Thank you.
Thank you. Welcome.